And now to health matters. The Nigerian government on Monday confirmed 7,202 cases of diphtheria out of the 11,587 suspected cases across 105 local government areas in 18 states, including the Federal Capital Territory. The government disclosed this in a joint press statement signed by the Federal Ministry of Health and Social Welfare, the National Primary Healthcare Development Agency, the Nigeria Center for Disease Control and Prevention, and other development partners. The statement noted that most of the confirmed cases were recorded in Kano with 6,185 cases. Other states with cases are Yobe 640, Katsina 213, Borno 95, Kaduna 16, Jigawa 14, Bauchi 8, Lagos 8, the Federal Capital Territory 5, Gombe 5, Osun 3, Sokoto 3, Niger 2, Cross River 1 case, Enugu 1 case, Imo a case, including Nasarawa and Zamfara that also had 1 case each. He stated that 5,299 of the confirmed cases, which is 73.6%, occurred among children aged 1 to 14 years, with those aged 5 to 14 years bearing most of the brunt of the disease. Now, joining me to discuss this is Dr. Adefolarin Opawoye. He is an infectious diseases consultant, Lagos University Teaching Hospital, and a public relations officer, Nigeria Infectious Diseases Society. Thank you so much, Doctor, for joining us to shed more light on this bacterial infection.
Good afternoon. Thank you very much for having me here.
According to the Federal Ministry of Health, a total of 453 deaths were said to have occurred in confirmed cases, given a case fatality rate of about 6.3%. Is this something we all should be worried about?
Oh, definitely. I mean, one death is one too many, you understand? And especially when you look at the fact that many of these deaths are occurring in children, then it gives you worries as to where we are going. I mean, there's the future of the country that is going away. So it's something that we really need to get worried about, because if we do not take enough control measures now, things are going to get worse. That's the truth. And we have to sort of like try and nip things in the bud before it really goes out of control.
For the sake of those who might not really know or understand what diphtheria means, kindly tell us what this bacteria is all about and how it has become a contagion.
Oh, well, I mean, diphtheria it's been there for a very long time, actually. It's something we almost can call an emergent disease, because it wasn't a concern, until last year when we started reporting new cases. I think we actually started reporting from Lagos, and then all of a sudden everybody started looking for it, and then we had so many cases. It's a bacterial infection, just like you said. It basically affects the upper airway. That's the truth. And that's why some of the pictures you have shown, you have seen the pseudo membrane, which is at we see at the back of the throat, which is like one of the classical things you see in diphtheria. So it looks like your standard sore throat, quote unquote, because people that have it, they have this fever, they have sore throat, but that pseudo membrane, you see it when you look into the mirror, you see that membrane covering the back of the throat. That's a major problem with diphtheria, because if you're not careful, that membrane is going to cover the entire throat. The patient is not going to breathe, and then the patient dies basically suffocated. That's the problem with it. And the challenge is that it's difficult to differentiate it from other benign causes of sore throat if you do not really go for testing in the facility. And we Nigerians generally, that's the membrane we're talking about, and that membrane, if it covers the entire throat, the patient will not be able to breathe anymore, and that's what actually kills them at the end of the day. And so it's really important to sort of like try to get to seek help early when you have this fever and sore throat, and then we can start medications immediately. And it's something that is easily curable, to be honest. It's not a very difficult disease to cure, but the problem is being able to diagnose it on time and starting treatment on time, and then being able to check around and look at the contacts of the case so that you can start preventing medications and then before it becomes a major challenge. But it's just because of a weak health system. And if you look at the distribution, you see that the areas where you don't have very strong health systems is where you have more cases.
Earlier on, you said that these particular bacterial infection affects children more, if I did get you correctly. So I'd like to find out, is it as though that children between the ages of 1 and 14 and as the report says, between the adolescent age are the ones that are more prone to this infection, and why?
Well, it's just a question of immunity. The immunity of adults is just a bit more developed than children, and so it offers an advantage in this particular case. Contrary-wise, in cases like COVID-19, we all know that children were somehow spared, and then the diseases ravaged adults more. So it's just a seesawing, and that's how things are in medicine. Some things children seem to take it better than adults, and it's the reverse for other conditions. But in diphtheria, because the immune system of adults are a bit stronger than that of children, and so they don't tend to come down with very severe cases. We've seen few cases among adults, but not very severe. Most of the severe cases and deaths actually are from children because their immune system is not as developed as that of adults.
From the stats that is before me now, I see that it's more pronounced in the north, where we have Yobe with 640 cases, Katsina 213, Borno 95, Kaduna 16, as compared to other states in the southwest, and of course, yes, in the southwest, of course, in the east. So, does it have to do with a cultural practice, or why does it seem as though it's prevalent in that part of the country?
Okay, so when you're interpreting this kind of data, you have to be careful because what you don't look for, you don't find. So sometimes when you look for it more, you're going to find it more. So it may just be a testament to a stronger surveillance system in these areas that is making them to pick up more cases. However, that being said, we should also note that acceptance of vaccines is not very, the uptake of vaccine is not very good in some parts of the country. And some of the pattern of distribution of this disease actually show that. We know there's a lot of vaccine hesitancy in some groups, and they don't want to take the vaccine. Diphtheria is a vaccine preventable disease. We have vaccines for it. We've had vaccines for it for a very long time. But then, for a lot of reasons which I can't delve into now, some people will not take these vaccines and then they come down with this disease. So, in those areas where there are issues with vaccine uptake, and these issues are myriad, vaccine hesitancy on part of the people, and also, some of these areas have also been plagued with a bit of insecurity and all that, and so it has disrupted routine vaccination activities. Also, do not forget the impact of something like the COVID-19, which has sort of like suspended the normal routine practices in the health system. And just now we are seeing some of the effects of that disruption in 2020, 2021. So there are quite a few factors where it seems to be predominant in some parts of the country than others, and I've tried to enumerate some of them.
So let's talk about how to curb the spread of the virus, because of course vaccination might not be the ultimate thing that can be done. If we are able to nip it, then we can reduce the indices. So how do we go about doing that?
So, contrary to what you just said, vaccination is probably the most effective public health measure that we have in countering the spread of diseases. And the only disease that has been eradicated in the history of mankind is smallpox. And that was because there was widespread vaccination that was done. Last case was, I think, it was said in 1978 or so. And it's out of the picture totally. So vaccination is the cornerstone here, really, to trying to deal with cases, right? Make sure you vaccine all people that are supposed to get vaccinated, booster doses for those who need it. But also, I agree with you in a bit that, some of the cases that we develop now, we are past the vaccination stage. So once that happens, then we want to do active surveillance, make sure you look for cases, and once you find them, you treat them immediately. So what the advice out there is that when you have fever and sore throat, okay, try and seek help. Many of us will not go to the hospital if we have seen fever. So we believe, it's malaria, then you go and take anti-malaria. No, it's not malaria. It may be something sinister, maybe something dangerous. So you seek for help early. Hopefully, when you seek for help early, then we can deal with it. But most importantly, if you look into the back of your throat in the mirror and you see membrane there, you run to the hospital, because then that could be a serious problem. It could just be membranous tonsillitis, but in the context of an outbreak, it could really be diphtheria. And like I said, if that membrane covers the entire throat, the person will not be able to breathe, and that's it. And so vaccination is one of the things we do. It's very effective. It's very important. People should try to take their vaccines. And if need be, they should take booster doses. But that being said, again, prompt referral of cases. Once you see a case, once you feel sick, please go to the hospital. Don't just go to the pharmacy. Don't just self-medicate. Go to the hospital. Let us look at you. And then there's a start treatment early. and hopefully we'll be able to escape these avoidable unnecessary deaths.
Okay, so before I let you go, Doctor, I'm aware that there were isolated cases of course, chronic conditions for those who had been in advanced stages, and there was this antibiotic susceptibility test conducted, and they said that this bacteria was resistant to penicillin. So is it that it is morphing into a more deadly bacteria, and are there measures being put in place to improve the quality and the potency of vaccines that will be administered to see that we're able to combat with this bacteria and probably put an end to its, of course, fatality mode?
So traditionally for diphtheria, we actually prefer to use the macrolides. That's erythromycin, azithromycin. That's what we used to treat. But it's actually a big concern that they're getting resistant to even penicillins. And it's not a surprise because, again, we have a serious problem with antimicrobial resistance in Nigeria, where people use antibiotics anyhow. I mean, they don't go to the hospital, they just go and self-medicate. Sometimes you don't even need to get to a pharmacy before you buy these drugs. And the challenge with this is that the more these drugs are used, the more the bacteria, they get wiser and they evolve and they develop and they adapt and become resistant to the bugs. So it's not about developing stronger antibiotics because there's only a level and a limit to which you can go. The major challenge there is reducing unnecessary widespread use of antibiotics. In agriculture, for example, a lot of farmers use this thing in their poultry. By the time we consume the meat or the eggs, this resistance gets transferred. Okay, people do not get to the hospital when they are sick; they self-medicate. You understand? So these are all issues, and the bacteria, they are learning, they're getting wiser, they're adapting to these things. And so the real challenge here is not developing stronger antibiotics; is using what we have judiciously and making sure that we don't we reduce the scourge of antimicrobial resistance, which is also becoming a very, very serious problem in the healthcare community.
Dr. Adefolarin Opawoye, thank you so much for educating us today.
It's a pleasure being here. Thank you.